When it comes to Medicare, there are three common mistakes that are happening all the time that could be easily avoided. So in this video, I want to walk you through what these three mistakes are. When you first join Medicare, you can do whatever you want, but later on, you're not guaranteed to change plans in the future. So it's so important to get your Medicare decision right when you first join Medicare. I'm Emily with the Medicare Coach. We are an independent fee-based consultant helping our clients easily navigate both the Medicare rules from the government and insurance company options to do what's right and best for them to have the best healthcare while protecting their retirement savings. So let's hop into this video, and you'll see down below, I will have additional resources for you to give you extra tips when it comes to Medicare. So the first step that I see people make, mistake I see them make all the time, is joining Medicare at the wrong time. Now, this probably sounds a little silly because people assume that you must join Medicare at 65, but that's not the case. Medicare rules say by the time you're 65, you either need to be on Medicare or on an employer plan that meets Medicare rules. So for those of you who do have employer health insurance, it could be your employer or a spouse's, as long as it meets these rules, you can delay Medicare. Now, when my dad was approaching 65, he got this letter from the government that said something along the lines of, you must join Medicare at 65 or you may be penalized. But they didn't explain it any further. And with more and more people working past 65 or having employer health insurance past 65, the first thing you should be asking yourself is, should I be joining Medicare? When should I be joining Medicare? It's not always going to be at 65. And to that point, if you have an HSA account, there's extra rules as well. So mistake number one is assuming you have to join Medicare at 65, and it's not the right thing. I've also seen people though who've delayed Medicare past 65, assuming that their employer plan met Medicare rules, and that's not necessarily the case either. COBRA does not meet Medicare rules. So you want to join at the right time so that you avoid penalties and have the best coverage. Mistake number two, picking the wrong program. So when it comes to Medicare, Medicare offers the main Medicare Part A and B services. And they're kind of two different paths or two different programs to get those benefits through. The first one is called Original Medicare, also called Traditional Medicare. And the second program is called Medicare Advantage, okay? We oftentimes see people, one, not realizing these different programs, these different paths even exist. And they tend to hear from insurance companies about the perks or the options of where to go. Many people end up on the wrong plan when you first join Medicare. And this is a big deal because Medicare has what's called guarantee issuance rules. In most states, if you first run Advantage plans and you want to go back into Original Medicare, while you can join Original Medicare, you're not guaranteed to get a Medicare supplement plan in most states. And without that plan, you have significant financial risk. So my point is this. It is very important when you first join Medicare to understand that there are two different programs and understand your future options, your future flexibility, because your initial decision to Medicare does have lifetime implications. So be aware of that. Now, the third mistake that I see people make is only looking at premiums. People will pick up plans based on the zero premiums or even like free perks, right? Gym memberships, free vision, free dental, things like that. When people look at really mainly just the premiums, you're overlooking the other costs to a plan. Unless you're on, say, Medicaid, there will be other costs to plans. So please look at the copays. Look at your medication copays, your doctor's copays, your physical therapy copays, all those costs. Look at your max amount of pocket, right? What could you max pay for an entire calendar year when it comes to your healthcare? Those other costs are very important to be aware of when it comes to your coverage so you understand your financial risk as you approach Medicare. Again, there's more to Medicare than just premiums. People oftentimes regret their decision as they assume that they would always be healthy, which I hope that we all are always healthy, but they didn't plan for the what ifs. So please be thoughtful. Please see those costs. You can make an informed decision when you first join Medicare. Now, down below, I will share extra resources with you so you have some more inside tips to get the most out of Medicare. Medicare can be great for you, but the insurance companies can be a little noisy, okay? So check out the link below for those resources and make sure you like this video for more inside tips when it comes to Medicare.